It has been nearly a month now since the U.S. Food and Drug Administration issued an alert, which some Nevada health workers had already warned them about. COVID antigen tests are prone to giving false positive. Denise Valdez now joining us with today's Health Watch. Denise?
Well, hi there, Brian. So how reliable are these rapid tests that thousands of people are getting? First, let's start with the two standard diagnostic tests, and they are actually quite different. First, the molecular or the PCR. Now, it's pretty accurate. It's a lab-based test that can take days to process and get the results. The test detects the virus's genetic material. Then the other is the antigen. It's a quick, right-on-the-spot test that's less sensitive than the PCR, but it's pretty good at identifying people who are at or near peak infection. Now, unlike those lab-based molecular PCR tests, they detect snippets of the virus's material, and are less sensitive, and they can detect samples with a high viral load. Now, the tests were validated for people with COVID-19 symptoms pretty much in the first week of symptoms. Now, in that scenario, they're pretty darn accurate, but it's trickier when it comes to asymptomatic screenings. In fact, about 40% of infections are spread by asymptomatic people with a high viral load. So antigen tests, even though they might be a little imperfect, they shouldn't be dismissed. Dr. Kathleen Winston, who is the Dean for College of Nursing at University of Phoenix, maintains widespread antigen testing is still the key to curb the spread.
You have to have a certain level of virus in your bloodstream in order for a diagnostic test to be accurate. So again, the test that we're looking for current infection, that's the measure of the accuracy of that test. So if I have a high viral load, I have the nasopharyngeal swab test for the virus, then that will give me a more closely correct and accurate positive diagnosis.
Now, depending on the quality of the antigen test and also the test takers, false negatives could be as high as 20%. Now, the concern is false positives could be caused by the presence of other viruses. Maybe they weren't collected properly, or even sometimes the swabs may not have been stored at the proper temperature. Still, though, antigen testing technology continues to improve, and you should get tested if you feel sick.